Hi, I'm Winnie Feng. I'm a PGY2 general surgery resident at Creighton University, Arizona Health Education Alliance, and this is a pilot study on using expired blood products to reperfuse cadavers to achieve a higher fidelity surgical simulation. So as we know, cadavers have long been the gold standard in surgical simulation. There's no synthetic model that can truly replicate human tissue when it comes to surgical training. Historically, various methods have been used to improve the authenticity of cadaveric models, such as transitioning from the heavily embalmed, stiffer cadavers to softer embalming methods. More recently, several cadaver labs have played around with reperfusing cadavers using crystalloid-based solutions, usually with like a red food coloring or red dye. But this, however, can lead to unintended third spacing and interstitial leaking over the course of a simulation, which can cause edema and distort tissue planes. Not so ideal when trying to maintain authenticity during a simulation. So our aim is to use blood products as a perfusate to produce a higher fidelity model for surgical trainees. So for our study, we first gained vascular access in our cadavers by exposing the right carotid artery and doing a retrograde cannulation. And depending on which procedure we were doing, we could opt to selectively perfuse certain parts of the body by occluding, for example, the left carotid and bilateral femoral arteries so that we would only reperfuse the torso. The expired blood products that we used all underwent the same rigorous screening protocols that any hospital, any blood bank uses prior to us using them. We would infuse the blood into the cadavers using a pump that could titrate the flow rate just depending on the operation we were doing. Our participants included 8 surgical residents and 2 attending physicians. And at the end of the simulation sessions, they were given a survey to rate their experience using working with these cadavers and comparing the cadaveric tissue to living tissue. The residents were also asked about their level of confidence in performing these procedures and operations in the future. So the procedures that were done included tube thoracostomies, chest tubes, Foley placement, thoracotomy, exploratory laparotomy with open splenectomy, ligamentous knee dissection, superficial temporal artery to middle cerebral artery bypass, a gracilis flap, and a robotic retroperitoneal bilateral adrenalectomy. So for this pilot study, as you can see, 8 different procedures and operations were performed on 4 different cadavers. Based on the survey we gave to our participants, the reperfused cadaveric tissue was rated as highly realistic as far as appearance, elasticity, and turgor. The cadaveric tissue was also rated fairly close to living tissue as far as tissue edema. And all residents noted an increase in their confidence when performing these procedures by themselves in the future. Everyone who took the survey also agreed that these simulations were highly applicable to real-world scenarios. So in conclusion, we were able to demonstrate that expired blood products could successfully be used to reperfuse cadavers and maintain a high fidelity simulation while remaining safe for the participants and feasible. As you can see, this model of surgical simulation was applied to various subspecialties, including but not limited to trauma, vascular surgery, minimally invasive surgery, neurosurgery, and orthopedic surgery. The practicality and advantages of this cadaveric simulation supports incorporating this into our surgical training. Using a perfusate that will maintain tissue authenticity, unlike that of other crystalloid-based perfusates that have been used in other studies. In the future, I think we can try to apply this to even more types of operations, more surgical subspecialties, and even simulate intraoperative obstacles and complications to provide a safe, low-risk environment for surgical trainees to face different scenarios that they'll inevitably face when in practice. Thank you for listening.